This is Dr. Vinay Samuel Gaikwad. I'm a surgical oncologist who specializes in gastrointestinal cancer treatment. I want to talk to you about whether stage 4 colon cancer can be cured or not. In other words, is advanced colon cancer curable? So, first we have to understand what stage 4 is. Stage 4 means that the disease has spread from the colon to other parts of the body, such as the liver or lung or the peritoneum or the lymph nodes which are away from the colon or the retroperitoneum. So there are three patterns of spread that we recognize in colon cancer. One is through the blood. Cancer spreads through the blood, it goes to the liver most commonly, or sometimes to the lung. And if it spreads to the lymph nodes, it spreads to the lymph nodes around the colon first and then can spread to the lymph nodes away from the colon. And third type is a peritoneal spread, which spreads along the lining of the abdomen, called peritoneal carcinomatosis. So there's a term called oligometastasis, which means very limited disease spread. Maybe a few, 1, 2 or 3 lesions in the liver, or a lesion in the lung, or limited peritoneal carcinomatosis, which means a few deposits in the omentum or in the peritoneum. So if there's limited disease in the peritoneum, if there's limited disease in the liver, and so on, yes, we do label these patients as potentially curable, which means there is a certain section of patients with stage 4 colon cancer which can still be curable, especially with advances in treatment options, surgical treatment options, surgery to remove the complete tumor in peritoneal disease, such as cytoreductive surgery with or without HIPEC, which is hyperthermic intraperitoneal chemotherapy. That's one option. Surgery for treating liver disease, like surgical treatments, liver type treatments such as frequency ablation, microwave ablation, TACE, and even a special treatment we are offering called hepatic artery infusion pump, in which a catheter is placed into the hepatic artery and chemo can be delivered directly into the liver, treating the liver tumor and not affecting any other part of the body with the adverse effects of chemotherapy. So such treatment options are available with us, and this video is to encourage you to not lose hope, and cure is still possible in certain patients with advanced or stage 4 colon cancer.